Hi everyone, welcome to today's session. We are going to see question and answers from oral pathology. So moving on to question number 1. Hex disease is caused by, they've given us 4 options: herpes simplex, human papilloma, herpes zoster and varicella zoster. The answer to this question is human papilloma virus. So if you see Hex disease, it's also called as focal epithelial hypoplasia, and it is nothing but uncommon proliferation of the oral mucosa, and here it presents as asymptomatic papules or nodules on the oral mucosa, gingiva, tongue as well as on the lips. So moving on to question number 2. Which amongst the following diseases is capable of producing developmental alterations in teeth? They've given us 4 options: tetanus, chickenpox, diphtheria and syphilis. The answer is syphilis. As we all know, it causes Hutchinson's teeth. It is a sign of congenital syphilis. So moving on to question number 3. Dilated odontome is a synonym of, they've given 4 options: dens invaginatus, talon cusp, dens invaginatus and macrodontia. The answer to this question is dens invaginatus. So what is this dilated odontome? The dilated odontome is a completely inverted structure of hard tissue which happens due to severe invagination of the enamel organ into the developing dental papilla. So in a radiograph, when you see, it will give a shell-like structure with an outer radio opacity and a central core of radiolucency. So moving on to question number 4. Which of the following is the synonym of Fissure tongue? They've given us 4 options: geographic tongue, lingua nigra, scrotal tongue and lingual varix. The answer to this question is scrotal tongue. So what is this fissure tongue? How does it look like? Fissure tongue is a benign condition affecting the top surface of the tongue. A fissure tongue is marked by a deep, prominent groove in the middle. There may also be small furrows or fissures across the surface, causing the tongue to have a wrinkled appearance. So moving on to question number 5. Which of the following is not a cause of macroglossia? They've given 4 options: hemangioma, lymphangioma and Down syndrome and leukemia. The answer to this question is leukemia. So if you see, what is macroglossia? Macroglossia is nothing but enlarged tongue which is clinically diagnosed. Pseudomacroglossia is a tongue that is in normal size, but it will give a false impression of being too large because the anatomical structures which are adjacent to it will be small in relation to it. So moving on to question number 6. Which of the following cyst has highest pre-malignant potential? They've given 4 options: dentigenous cyst, calcifying odontogenic cyst, odontogenic keratocyst and lateral periodontal cyst. The answer to this question is odontogenic keratocyst. So, an odontogenic keratocyst is a rare and benign but locally aggressive developmental cyst. Around 19% of the jaw cyst will fall into the category of the odontogenic keratocyst. Moving on to question number 7. Forthagel's disease is, they've given 4 options: glossopalatine neuralgia, spinopalatine neuralgia, giant cell arteritis and trigeminal neuralgia. The answer to this question is trigeminal neuralgia. So it is also called as tic douloureux, trifacial neuralgia or trigeminal neuralgia, as we saw here. Moving on to question number 8. Hypoplasia of parotid is seen in, they've given us 4 options: Crouzon syndrome, Melkerson-Rosenthal syndrome, hemifacial microsomia and Sjogren syndrome. The answer is hemifacial microsomia. So moving on to question number 9. With increase in age, which cells of salivary glands increase in number? They've given 4 options: myoepithelial cells, serous cells, oncocytes and mucus cells. The answer to this question is oncocytes. Oncocytes are epithelial cells with abundant granular eosinophilic cytoplasm due to the presence of numerous large mitochondria of varied sizes. So moving on to question number 10. Absence of 6 or more teeth is termed as, they've given us 4 options: oligodontia, hypodontia, anodontia and partial anodontia. The answer to this question is oligodontia.